Thank you, Mr. Speaker. Mr. Speaker, the federal government has been running a universal nationalized health care system in the United States for over 100 years. Just ask those folks that live on Indian reservations. Socialized medicine doesn't work, and America has already proved it by the way it has mistreated Native American Indians. They are treated under the Indian Health Services Program, a universal government-run health care system for Indians. There are long waiting lines for service, doctors are scarce, the quality of medical care is poor, it costs too much, and it results in rationed health care. And when the government is running health care, people die. Now the administration is forcing universal health care on everybody. Let's look at some of our history on American-run health care. When Stephanie Littlelight took her daughter, Tashawn Rain, to the Indian Health Service Clinic in Montana, which she was required to do since she's under the Universal Health Care Indian Program, the doctor said her little 5-year-old girl was just depressed. She had stopped eating and stopped walking. The little girl kept complaining to her mom that her stomach hurt. And after going back to the government-run health care clinic 10 more times, Tashawn's lung collapsed. She was airlifted to a private, non-government hospital in Denver where they told her mom she had terminal cancer. The little girl who loved to dance and sing and dress up in Indian costumes always wanted to see Cinderella's world at Disney World. A charity sent the whole family there, but Tashawn didn't get to see the castle. When they got to Florida, the little girl had died in her hotel room. Her mother says she still cries when she remembers how her daughter was always in pain before she died. There are more examples. The doctors at the Health Run Clinic, the Indian Health Run Service, told Stephanie that there was nothing wrong with her daughter, that she just had all of this in her mind. This is a tragic example of medical health care run by the United States government. There's a big difference between good intentions and what really happens in the real world. When there are no doctors left and the taxpayer money is gone, when bureaucrats control health care, people die. Is this what we are to expect under the new nationalized health care system? Mr. Speaker, they say on these Indian reservations, don't get sick after June because that's when all the federal money runs out. So they ration health care. The Indian Health Service Agency calls itself, get this, health care system. How's that for truth about socialized medicine? Rhonda Sandlin lives in Saging Rock Reservation in North Dakota. She has had a terrible case of frostbite on both her hands, and their hands had turned purple. The pain got so bad that she could not even dress herself. She visited the Indian Health Service Clinic over and over again. Rhonda says she didn't get any help there until she threatened to kill herself because of the pain. The clinic then decided to cut off 5 of her fingers. Lucky for Rhonda, there was a private doctor that just happened to be visiting the reservation. He prescribed her medicine that she needed instead of cutting off her fingers. She's okay today. Victor Brave Thunder was not so fortunate. He felt real bad and he went to the same government clinic as Rhonda. They misdiagnosed the fact that he had heart failure and gave him Tylenol and cough syrup. He later died. Marcella Buckley has access to all the free government health care she can stand. Once again, she's required to go to the government Indian health care services. Marcella had stomach pains and went to the government clinic on her Indian reservation for 4 years. She was given a whole host of reasons for her stomach pain, including the fact they said she might have a tapeworm. Eventually, she found out she had stage 4 stomach cancer and it had spread all over her body. Now she seeks treatment at a private provider. On another Indian reservation, Ardell Baker went to her government-run clinic because she had chest pains. They sent her in an ambulance to a private hospital where she noticed that they had put a note on her chest in the ambulance. And the note read, "Understand that Priority 1 care cannot be paid for by us at this time because of funding issues." So they put a note on her, send her on her way to a private hospital because they can't take care of her. Ardell managed to survive that ordeal thanks to private medicine. But it was too late for Harriet Archambault. Harriet died when her hypertension medicine ran out. She tried 5 times to get an appointment to refill that medicine. Government bureaucrats nowhere to be found. So she died before she could ask for that 6th appointment at that government clinic. Mr. Speaker, these are examples of government-run medical malpractice against the Indians right here in America. Government-run health care never works. Even in America, we've proven it doesn't work. And Mr. Speaker, I will just close by saying this. If you love the way we run the Postal Service, and you love the way that we run FEMA, and you love the compassion of the IRS, you will love the new nationalized health care system. Just ask the American Indians. I yield back.
Gentleman yields back.